Okay, I will just probably best that Renee is actually not on the list just because, if a member is on without a camera, I think that's a problem. So we'll just get started here. Welcome to the April 15th, 2026 Licensing Committee meeting. My name is Sang-Oh, Chairperson of the committee. Before we convene, I would like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be protected, the protection of the public shall be paramount. As I facilitate this meeting, I will announce when we're accepting public comment. I have advised the meeting moderator to allow 3 minutes to each individual providing comments. Over the past several meetings, the committee has faced time constraints resulting in deferral of the discussion, so we have a very full meeting today, and as chair, I reserve the right to reduce the time allocated to each speaker based on factors including the number of persons wishing to comment. Should adjustment be necessary, I will make an announcement. As a reminder, as included in the agendas, the committee provides the contact information for individuals to provide written comments in advance of meetings should they so choose. Thank you all for your understanding. We will begin with public comments for individuals attending in person in Sacramento, followed by public comments by individuals participating via WebEx. This approach is necessary to facilitate this meeting. Before we get started, I would like to ask staff monitoring the meeting to provide general instructions. Moderator?
This is the moderator. When we reach public comment on WebEx, individuals can press the raise hand icon in order to indicate that they would like to make a comment. If you're a call-in user, you can press *3 on your device to raise your hand. You'll be given 3 minutes to speak with a 10-second warning, and at the end of the time, you will be muted, and we'll move on to the next individual requesting public comment. I believe that is all the instructions that I have.
Thank you so much, moderator. I would like to take a roll call to establish a quorum. Dr. Satinder Sandhu?
Present. Licensing member.
Thank you. Renee Barker? Renee probably has not resolved her technical challenges, so we'll move to Dr. Jessica Crowley.
Licensing member present.
Morning, Jessie. KK Ja? Don't believe KK is able to make it today. Claudia Mercado?
Present.
Thank you, Claudia. And I'm here. A quorum has been established, and as soon as I see our Dr. Renee Barker on, we will get back to her to confirm her attendance in this meeting. A quorum has been established, members. We have a full agenda for our meeting today. I ask everyone participating today to be respectful of the work before the committee. We encourage participation by members of the public throughout our meetings at appropriate times. The committee respectfully requests that when comments are provided, they're done so in a professional manner consistent with how the committee conducts its business. Before we move to the next agenda item, I would also like to remind members participating via WebEx to please remain visible on camera throughout the open portion of today's meetings. If you need to temporarily turn off your camera due to challenges with internet connectivity, please remember to announce the reason for your non-appearance when you turn off your camera. Finally, I would like to ask staff to send out a link to all board members when the live stream of the meeting is available. This will ensure members that are interested have an opportunity to review the meeting prior to the next board meeting. Thank you all. Next, agenda item 2, public comment on items not on the agenda items for future meetings. I will now ask the moderator to open the line for individuals to provide opportunity for public comment on items not on the agenda. You're not required to identify yourself, but may do so. I would like to remind everyone that the committee cannot take action on these items except to decide whether to place an item on a future agenda. Accordingly, if your comment pertains to an item on today's agenda, please save your comment for the public comment period specific to that agendized item. Members, following review of the public comments for this agenda item, I will ask members to comment on what, if any, items should be placed on a future agenda. As a reminder, this agenda item is not intended to be a discussion, rather an opportunity for members of the public and members of the board to request consideration of an item for future placement on an agenda, at which time the discussion may occur. Are there any members of the public in Sacramento location? I will try to, I see the video feed. So I see there's 3 gentlemen. Welcome to the meeting. And if you do have anything to comment, please just raise your hand just so I know that you would like to say something. Just so that I can keep on moving forward and not have to keep waiting for some body language. So please raise your hand. I would really appreciate that. Also, board staff in the room can please let us know if you all are wishing to speak. If anything, I can always get back to you all too. And now we'll go to public comment in WebEx. Seeing no in person, we'll go to public comment in WebEx.
All right, this is a moderator for members of the public on WebEx. If you would like to make a public comment for items not on the agenda, please click the raise hand icon, or if you're an audio only participant, you can raise your hand by pressing *3 on your device. I'll give just a couple moments to allow the public to access those features and submit their requests. All right, and it appears there are no requests for public comment at this time.
Thank you, Sarah. That makes it quick for us. All right, members, any thoughts or anything you would like us to discuss in a future meeting? Seeing none, we are ready to move on. While we're doing that, since we are swiftly moving through, just want to make sure we are looking for our member Renee. Oh, but I see the little hand raised after, so I see the Dr. Gray's hand raised. He might have gotten there a little bit before, so we're backtracking. Just want to make sure he has an opportunity to say something if he has for agenda item 2.
Sure thing. This is the moderator. Stephen, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Good morning. Thank you very much for the opportunity. I have 2 comments. I would appreciate time for each one. My first comment relates to a problem that I've raised before several months ago. Recently, the law was changed to require pharmacies that are going to close to give notice to patients, notice to public officials, and notice to the public in general. This was a public protection measure that was very much related to the COVID crisis, where patients were left without knowing where to go to get their medications when pharmacies closed, and some pharmacies closed permanently. The problem that I raised was that the law applied to grocery stores and pharmacies. It did not apply to outsourcing facilities. And I suggested that the board agendize a discussion for changing the law to have it apply to outsourcing facilities, because a lot of hospitals and even patients are very much dependent upon the medications they get from outsourcing facilities. Outsourcing facilities, as you know, can now distribute or dispense directly to patients. A comment was made by the board that this should be referred to one of the committees, and I don't see it on this agenda or a future agenda. So I would ask that that discussion be put on the agenda of a committee, whether it be the licensing, enforcement, or the legislation committee, because it would probably require input from all 3, or possibly input from all 3. So that's my first comment. My second comment relates to a serious problem we're having with the pharmacy law exam, the California Practice Standards and Jurisprudence exam. As many of the board members know, but not all of them, that exam is only updated every several years. And that's part of the problem. We don't know when it's updated. There are a lot of changes made in the sunset bill to the law. We teach pharmacy law to prepare students to practice as soon as they get their license. However, the students complain that the exam does not reflect the current law that they're going to be using as soon as they get their license, because of the lag between updating the exam and the law changes. I have been asked whether they can challenge all these questions. I've said, yes, there is a mechanism for each and every student who did not pass the exam to challenge every question on the exam, but that would be very onerous and hopefully unnecessary. I suggest that the licensing committee put on their agenda a discussion of how to resolve the problem. Also, the problem is very unfair to students who come from out of state who have not
10
had
seconds.
IPPE or APP experiences in California. And so they come and they study the current law, not realizing that the exam may not be reflecting current law. And some of the students
time
said they
is
had
up, so
actual.
we'll be moving on in our agenda. Thank you.
I asked for time to do 2 comments. I asked the president to make an exception.
Dr. Gray, sure, go ahead. Let's have you finish your thoughts on the last point.
Okay, the exam is very unfair to students who come from out of state because they come from out of state to take the exam and they naturally want to study current law where they'll be practicing in California. And again, they have not had the classes in California on pharmacy practice or the experience in California where they do learn some of the law, and that may be enough to make them able to pass the exam. So that's another reason this should be agendized for discussion. Thank you very much for your patience.
Dr. Gray, always. Thank you for your insights. And with that, members, do you have any comments or thoughts? I think I'm happy to definitely look into the outsourcing facilities. It's not that, I think we just have sometimes time constraints. So we would love to discuss that. And members, I see Jesse's hand raised, and then I'll go to Claudia.
Yeah, I agree. I think it would be good to have it agendized. I would leave it up to you to decide what committee would be most appropriate, maybe enforcement. And I think it may be worthwhile to have that specific discussion on the CPJE. I don't know which committee would be most appropriate, so I would want to default to you for that one as well.
Okay,
So
sounds good. Thank you, Jesse.
I'm so sorry. This is Anne. Before, the committee considers taking any action specific to a public discussion on the CPJE, we need some opportunity to talk about that internally and look at what the law provides.
Okay, Claudia?
Oh, this is the moderator, Claudia. You are muted.
I just wanted to thank the public comment. I think it's really valuable, so I appreciate everybody on the call being here today.
Thank you. All right, members, let's move on to agenda item 3, discussion and possible action to approve minutes for January 8th, 2026 committee meeting. As we begin our consideration, I'll ask if members have questions or comments on the draft minutes from the January 8th, 2026 meeting found in attachment 1 of the meeting materials. I would also entertain a motion if you believe such action is appropriate. Members? All right, I think while we're doing that, Renee is trying to join back, but I think we can hopefully multitask. Any comments, members? We need a motion to approve the minutes.
Hi, Sung. It's Jesse. I'll move to approve the minutes.
Thank you, Jesse. Do we have second?
I'll second, Claudia.
Oh, thank you. All spoke at the same time. I'll go with Claudia, and then I see Renee there. She's probably gonna get on with the background soon. All right, with that, any other comments? I don't see anyone, so we are ready for public comment in Sacramento. Nobody is raising their hand. We are ready for public comment in WebEx.
All right, this is the moderator for members of the public on WebEx. If you would like to make a public comment for agenda item 3, please click the raise hand icon, or if you're an audio only participant, you can raise your hand by pressing *3 on your device. I'll pause a moment to allow the public to access those features and submit their requests. All right, and I do have a request from Melanie Horn. Melanie, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Good morning, and thank you for the opportunity to provide public comment regarding the meeting minutes. Is that correct?
Correct, Miss
Okay,
Dr.
great.
Horn.
I lost contact for a few minutes. My signal went a little wonky, so thank you. I just wanted to make a note that in the last table regarding the statistics, the table does not show that the numbers are in days. I had to go through the actual meeting minutes to find the comments around the numbers being relative to days versus possibly weeks or something else. And I think that reflects a great deal of the work that you guys have done. So I just wanted to make a public comment to suggest amending the meeting minutes to include that the table is in days. Thank you so much for the opportunity to comment.
Thank you so much, Dr. Horn.
All right, this is a moderator. Appears there are no further requests for public comment at this time.
And just want to circle back to member Dr. Renee Barker. Hi, Renee. Are you able to speak? Hopefully, I see you.
Okay, can you hear me okay?
There we go. You sound great.
Yes.
Awesome.
I've had double computer failure, so I'm here with the background's gone. And then just to note, so I was actually listening through the whole meeting. I just was not able to access my camera for the other computer. So anyway, here I am.
Your internet connectivity challenges, I would imagine.
Due to my
Thank
internet
you.
connectivity challenges. Thank you.
Thank you, Dr. Barker. Awesome. I will start with a roll call with Dr. Satinder Sandhu.
Licensing member present.
Oh no, just for the votes, Satinder.
Excuse me, President O, I'm so sorry.
Yeah.
This is Corinne, Board Counsel. I just wanted to clarify, since the motion was to approve as presented, and then there was a public comment suggesting an amendment. Are you approving them as presented? Are you approving them with the suggested amendment, or how would you like to proceed on that?
I thought that it was a very benign request that I didn't think that it would be necessary for us to amend the motion. I think that that's something the staff can look at in the background, but I will defer to the member who made the motion, Dr. Crawley.
I guess maybe for the sake of simplicity, I will amend the motion to include the amendment from public comment.
So sorry to jump in. I know you're hating me right now, so hang in there with me, please. So I'm looking at the minutes specifically, and it does appear that we're referencing like the first 5 months of the fiscal year. I'm wondering if the commenter is referring to the meeting materials as opposed to the meeting minutes.
I think we can leave the motion as it was, as presented, Dr. Crowley, if
Okay,
that's okay
sounds
with you.
good.
So no amendment to the motion, Corinne. Okay. Satinder, how do you vote?
I vote yes.
Thank you. Renee?
Yes.
Thank you. Jesse?
Yes.
Thank you. Claudia?
Yes.
Thank you. And I vote yes, the motion passes. Thank you all. Moving to agenda item 4, and we would never hate you. What are you talking about? Never. Thank you for always being there. Agenda item 4, discussion of and possible action to make a recommendation to the board regarding policy statement related to new requirements for non-resident pharmacies included in Assembly Bill 1503. Berman, Chapter 196, Statutes of 2025. AB 1503 made several changes to laws governing non-resident pharmacies. To provide guidance specifically on some of the changes, it is recommended that the board release a policy statement to provide education and convey the board's policy related to compliance and enforcement of these legal provisions. Members, I draw attention to attachment 2, which includes a copy of the draft policy statement. I have reviewed the policy statement and seem appropriate. Welcome your comments, members. I feel like nobody is so gung-ho today in terms of comments. But I feel that this is a good statement just to share with the regulated public on our priorities and our current laws. And so I'm hoping that we have this, supported by our members. And we do not need a motion. I think that we would just like a discussion on anything that you would like to change. And we will bring it to the full board in a couple weeks for formal approval if it is acceptable to members. Jesse, go ahead.
Hi, thank you. The one note that I have, and I'm not sure if I've missed discussion in the past, but under the PIC requirements, where it says the designated PIC must be, and then lists number 1, employed and actively working at the non-resident pharmacy. I'm wondering if like that actively working is going to cause some confusion on what that actually means. Does that mean that they're physically in the non-resident pharmacy, or does it mean that they're just employed by the non-resident pharmacy?
Good question. I think that borderline touches a lot of legal probably stuff. So I'm not really sure. Maybe we can just simplify it, but I can touch back with our staff and our council to see if that's something that we can amend it or change it. I'm sure these are just words from the law. So, and then Satinder?
I just
Sorry,
wanted to, I
yeah.
just wanted to comment I don't know if this is appropriate or not, but I wanted to know, since we started this process, have we been getting any complaints as to not trying to meet the deadline? I don't want this to be interrupting the service to Californian consumers if there's challenges in, taking the exam or those kind of things. I don't know if there's any feedback we've gotten from the public to how it's going, and we'll be able to move forward without interrupting service to the California residents with this huge change.
Absolutely. Yeah, I'm sure we would all use very reasonable grounds and stands. I would very hope so. If not, I would like to convey that we would take things very reasonably. On that note, though, I would do want to also I know that, life is hard. But I do want to note that we have had this, I think that this has been a known thing since October of 2025. So I also want to just say that I think we will be as reasonable as possible, but also, and of course, we do not want any patient interruptions. But I think that I would like to highlight this has been a known thing for a long time. So we'll try to find a balanced approach. While you had a question, I don't think that we have any information, but I will just to make sure that it's addressed. And do you know anything requests or any complaints or anything coming that they are not able to meet the deadline? Maybe they don't want to share with you anyway, but
I would need to have internal conversations with my coworkers, but would, just want to reiterate that we added a couple of exam administrations to ensure that there was sufficient opportunity for people to take it even more than once if necessary. And we have been doing outreach, directly as well as through a number of communication channels to ensure that people are aware, and this is not something that, that catches people off guard. And the delay in the implementation of this specifically was to allow for, people to come into compliance. If you remember, the vast majority of the provisions in 1503 became effective January 1, and the board specifically through the sunset process did delay this until July.
Thank you. I saw that that extension of extending it 2 more opportunities. I think we can also look at it if person fails, are they able to sign up for the next available date, or is those dates are filling up? That could be a challenge. Sometimes if they fail, it could be a 3-month before they even might be eligible. So if we can look at all those things to remove as many barriers we can, that would be, I would suggest, so that we don't have any interruptions that are unintended consequences.
Thank
That's
you,
all.
Dr. Sandhu. Thank you so much. I completely agree with you. And then Claudia?
Yeah, I just wanted to add that on page 2, we give a really good explanation and guidance, but then we say, please visit the board's website, and we just take them to pharmacy.ca.gov, which is our home landing page. I wanted to suggest that maybe we can have a section or a separate landing page all around this topic, so that anybody looking for guidance has a direct point of contact to really take a look at all the available information. On this page, we also have a very small text that says see Business and Professional Code section 4112, and it's a hyperlink. So that's taking us to the legislative text. So again, if we could just have a landing page with all this information, I think that would be really useful for everybody. Even a way to have a feedback loop in it where we can take any comments. I'm not sure how that would work, but we'll love to see us being more interactive and more accessible.
Thank you, Claudia. I think so. The challenge I see with that is the pharmacy law is a bit vast and complex, and that's probably why we just had it link them to a more of a just a website, because there's so many layers and tentacles. I do appreciate though if there's a way for us to have a page that's focused for non-resident pharmacies. But I do think that gets a little challenging because a lot of these laws are applicable to them. So we'll see. I will talk to the staff and see what we can do, and maybe there can be more developments into the website. Maybe there's a page. I think we already have a page somewhat related to this, but absolutely we'll see what we can do, just more specific. So thank you.
Thank you.
All right, great feedback, members. Any other comments? This is not a we do not need to have a motion, so we are just starting this discussion. So any feedback, any and all, is appreciated, and I see that there are some folks probably eager to do public comment already, so we are happy to move on then to public comment. All righty, members in the public in Sacramento, anybody would like to make a public comment? Seeing none, we are ready for public comment in WebEx.
All right, this is the moderator for members of the public on WebEx. If you would like to make a public comment on agenda item 4, please click the raise hand icon, or if you're an audio only participant, you can raise your hand by pressing *3 on your device. All right, and we have a couple requests for public comment, so I'll go in the order received. First, I have a call-in user ending in 56, and for our call-in user, you will be given 3 minutes to speak with a 10-second warning. You're going to press *6 on your device to unmute yourself.
Hi, my name is Dr. Courtney Sullins. I am the head pharmacist of a mail order pharmacy in Woodway, Texas. The furthest documentation I have going back to when the California PIC license changed, when I first heard about it, was an email that I received on December 3rd. Starting December 4th, I started going through all the states where I'm licensed to see who I can get verification from online, and who I have to reach out and have a physical paper sent to them fill out and send it back to me. I'm licensed in 20 something states. I don't know. One of the states that I have to have a hard copy paper verifying my licensure there. I've sent the form to them 2 or 3 times. I've sent my husband there. I'm halfway through the timeline I have in order to get licensed in California, and I can't make any progress because other boards are unresponsive. So I don't understand how my pharmacy, like how I have time to get the state to get its act together, then get my entire application sent to you, give y'all the 30 to 45 days to review it, and then me have time and go and pass the test to get licensed between now and July 1. So I'm frustrated about this timeline specifically, since somebody was asking about that earlier.
The comments. I really appreciate you letting us know. I know that this is not easy, so I'm hoping that we could try to reach out to you somehow to make sure that this kind of stuff we can assist you better. So thank you. Please stay on the call. And all right, we'll move to the next.
All right, this is the moderator. Next, I have Sarah Moo. And Sarah, you'll be given 3 minutes to speak with a 10-second warning. Please click the unmute me button when the prompt appears on your device. And this is the moderator. Sarah, if you are speaking, you're currently muted. I'm going to request to unmute your microphone. Please click the unmute me button when the prompt appears on your device.
Can you hear me now?
Yes, we can hear you.
Okay, my apologies. Thank you for the opportunity to comment. I'm Sarah Polo Moo with the California Retailers Association and California Community Pharmacy Coalition. On behalf of California's retail pharmacy industry, we appreciate the board's effort to provide guidance on AB 1503 implementation. We're generally supportive of the draft policy's intent and its focus on patient safety and compliance clarity, but we have a concern about the policy's open-ended language. Our concern is not the substance, but the use of open-ended phrases throughout the policy, such as including but not limited to, and for example. In a compliance and inspection context, this language creates uncertainty for licensees about what is required versus what is merely illustrative and what may later become enforced expectations. Non-resident pharmacies rely heavily on written board guidance to design staffing systems and compliance programs. Open-ended examples create 3 real-world risks. 1, unpredictable enforcement. 2, over-engineering compliance to guard against undefined expectations. And 3, reduced patient access, particularly for smaller or regional pharmacies that may limit California services due to regulatory ambiguity. This document is a policy statement, not a regulation. Because it does not go through formal rulemaking, precision in language is especially important. Retail pharmacies accept oversight and inspection, but enforcement should remain anchored to clear statutory or regulatory standards, not expandable interpretations. CRA and CCPC respectfully ask the board to consider removing or narrowing open-ended phrases where possible and clarifying that enforcement will be limited to the listed examples by explicitly stating that any additional expectations must be grounded in statute or regulation, not policy expansion. In closing, we strongly support the board's goals and value continued collaboration. And we emphasize that clear, bounded guidance benefits everyone, including patients, regulators, and pharmacies. Thank you so much.
Thank you for the comments.
All right, this is the moderator. Next, I have Stephen Gray. And Stephen, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Thank you. First, I want to compliment the effort. I think this is really important and it will help hopefully solve a lot of the questions that come in from non-resident pharmacies. I do still have calls that want to know, for an example, first of all, number 1 is very important because most of the calls include questions about labeling and consultation in California. One of the things that they ask about is, as you know, consultation has to be available a certain number of hours per week and days per week. And does that apply? I say yes, but maybe you can further that. Past inspection reports, they want to know if that's all inspection reports or just the ones from California, and how long should they keep them? Master list of technicians. Many of the states don't license or register what they call technicians, which is anybody that works in the pharmacy for any amount of time, and that causes them confusion. Acquisition records, I would suggest that you add the 3-year requirement of California law, because some states don't require 3 years. And so that causes them confusion. And so it's a little bit of additional information, not a lot, but a little bit of additional information and clarification would go a long way in resolving some of these common questions. Thank you very much.
Thank you for the comments, Dr. Gray.
All right, this is the moderator. Appears there are no further requests for public comment at this time.
Thank you so much, Sarah. I think that there's definitely room for improvement. And so I'm happy to work with our staff to bring to the full board a little bit more of a clearer as much as we can in areas we can do. I really appreciate the comments. I just, sometimes it's just, remember, it's a policy statement. So I do understand the concern, but it gets a little bit hard for us to be so black and white in many areas of pharmacy law. Again, and that's the challenge we live in. But I think that Dr. Gray's comments, I really appreciated. We'll try to probably be more precise and clear in areas. And so we'll bring that to the full board. Members, any thoughts from our public comment or any other thoughts before we move to the move on? Jesse?
Hi, thank you. I think the public comments were great and really helpful. Also, as a person who had come from out of state and did not have any experience in California before coming here, I know that the process for licensing can be extremely complicated, especially if you have no guidance and no one else to refer to. So I did appreciate that comment just about the whole process, like fingerprint scans, things like that just didn't exist when I was trying to get licensed in Massachusetts. The unclear language, I think, with inspections, I think the way that I interpret it, and maybe we can work some language to make it more clear, is that, they are required to follow anything from California pharmacy law with the way that they operate. And so I think we can work on the language to make it clear what things are limited to. Dr. Gray's comments were extremely helpful. For example, saying pharmacy staff instead of just pharmacy technicians and pharmacists might clear up some confusion. And then for inspection reports, I imagine it would be helpful to have in-state and out-of-state reports accessible. But I'm curious to see how everyone else on the committee and the board feels moving forward.
Yeah, I actually took that as any and all inspection reports because I would imagine in my idea that a non-resident pharmacy would not have been most likely be inspected by a California Board of Pharmacy. So I thought of that as more of just any and all inspection reports, period, from the DEA or anybody else, just for gaining insights, right? I mean, if it's to me, that seems like. But again, I understand exactly the point that is being brought up is, it's kind of left it up to the, just the judgment. So, but again, I think it's just really hard to um, just set that this is the expectation. So I think this is a fluid discussion, and it is sometimes better that it's more of a reasonable fluid than so precise and so direct. And so, I know that it's never simple. So Renee, and I'll go to you. And also, before I forget, I'm so sorry, I almost forgot. Thank you, Jesse, for bringing that out of state licensee. Um, sorry, Anne, I'm blasting your email to the whole world. I mean, but I guess it is already out there anyway. I'm sure it's Dr. Google can just find your email anyway. So our executive officer is more than happy. Hopefully that caller, I don't have the phone number, but I think it was a caller on the phone call. So I'm so sorry I did not catch your name, but hopefully you're hearing. It is our executive officer is more than happy to help you really step by step, trying to get you through this process. So our executive officer's email is anne.sodergren, SODERGREN @dca.ca.gov. It's anne.sodergren, SODERGREN @dca.ca.gov. I'm so sorry, your email is gonna be just exploding. She's already running out of storage. DCA needs to have a special exemptions for her storage limitations. I request strongly. Anyway, Renee, I'll go to you.
Hi. Yeah, thanks. This is obviously very complex. I think maybe backing up a little bit. I think there's a lot of great conversation, but again, this is a policy statement, and I think every time we have a policy statement, there's a lot of I think it just has some confusion around it because it looks for people to try to understand if it is the complete set of what I need to know and do, which is not. So I'm thinking that if our policy statements had a statement about a policy statement, so I don't want to I want to eschew obfuscation. I don't want to clear up some of the complication, but I do think that the policy statement, I mean, this is, I mean, I've worked for decades in California and I still learning, but the law. But I think for new people, I mean, this is an overview, right? I mean, there's a lot, and there's a lot of practice settings. So in different types of pharmacies, and just talking about policy statements we've made and ones we'll make in the future. So if there was something that we would say is, this policy statement is intended, like whatever our wording we could come up with. I mean, I'm sure staff has some guidance when they write a policy statement. But
That's a great comment, Renee. Yeah.
it's never can be all inclusive. It would just be a paragraph and the law book. I don't know.
Exactly.
Right?
Yes.
Because
Yes.
you take yourself down certain paths. I mean, just all of these they look like one sentence, but just they're not like anyway. All of these, so inspection expectations, those are the tip of the iceberg when it comes to.
Oh, did Renee freeze on everybody? Oh, darn. Uh-oh. Our poor Renee is having a lot of technical difficulties. Oh, there you are. Oh,
Okay.
you're back alive.
Okay, sorry, I don't know. It's quite a day.
It was around the inspection reports part.
Oh, I just was saying that, each of these is there's a lot of details, even each and every statement in the inspection expectations list, for example. I mean, all of it is, right? So I do think a policy statement about the policy statement, like what it's really just meant to be like sort of a thought, the current thought, the guidance overall, which doesn't necessarily, like to Jesse's point, like I know, like it probably would be nice if there was some kind of or Claudia landing page to know what to do, but anyway, that's a whole other task list, but I'm not sure what questions would be being asked. So all I'm saying, I think for the policy statement is to define what it is.
Right. And I think that that's a great comment, Renee. And so just for the context for everybody maybe listening in, California board regulates quite a vast licensees. And, for compared to maybe some other, nothing against smaller states or smaller boards that has really limited number of licensees, we have just it would be impossible for us to individually direct how we want things to be done as a board, right? So that's why we have really kind of been using a lot of this policy statement as a way to convey our message and what we would like to focus, because there are, at least as far as I know, 6,700 some non-resident pharmacies. So, this is a way to really provide a better guidance. I really hope that this is not a way for our pharmacy. This is to be helpful, is the point that I'm making. This is not to be punitive. This is to provide some understanding of what we're trying to focus on at the California State Board of Pharmacy. And so I do think that it is a good idea, what Renee, you're saying, that what the policy statements are and what is not. And maybe we can also add that as we are utilizing our policy statements quite a bit lately, because AB 1503 and its changes that it's brought upon us, it's kind of, we're trying to move to the world of a lot of professional judgment for a pharmacist, but also maintaining that what the pharmacies must do are pretty, still strict and important for them to follow in terms of laws and regulations. So it's just I think that it's just understanding that we cannot get to every single situations and issues readily available, and so this is what we want to focus on. And if it needs to be brought up to us, it will be brought up to us, but it is a way for us to just kind of get the ball rolling. So great comments, everybody. And anyone else? So as we close on this agenda, I think that it is important to just remind everybody that this is effective July 1st, 2026, the licensure, and to inspect non-resident pharmacies. It also may be appropriate to develop a fact sheet on inspection specifically for non-resident pharmacies, describing what to expect during an inspection by the board. If the members are agreeable, I believe this could be coordinated by the Communication and Public Education Committee. With that, I think one last chance for members to share their thoughts, and we're ready to move on. Okay, let's move on. Oh, Claudia?
No, I just want to thank the public comment again. I think the discussion and the comments were great, so thank you all.
Thank you. I personally love the engagement from the public, so I always appreciate the comments from the public, genuinely. So I know, just it's a lot of comments and a lot of chatters, but it's always good when everybody speaks their minds and we can all try to make things a bit better. And this is intended to really provide a guidance and to be helpful for all the folks, and while maintaining our primary focus, which is consumer protection. All right, next agenda item 5, discussion and possible action to make a recommendation to the board regarding draft frequently asked questions related to digitizing pharmacy records consistent with Business and Professions Code section 4105. By the time that I leave this board, there may be 10,000 different policy statements and 10,000 different FAQs, but we'll start with one by one and at least, try to provide as much education as much as we can. So you may recall one of the implementation activities related to Assembly Bill 1503 was to develop FAQs related to the new provisions for digitizing pharmacy records. And included in the meeting materials are 4 possible FAQs, and I have reviewed them and I believe they are appropriate. And just a reminder to everybody, we are trying to transition to an FAQ, whereas the board approves them, it goes into a FAQ box, and based on a topic, it will be, you can search it. And I'm also conveying that it's got to be searchable within the FAQs by the words. So that's what we're trying to develop. So a searchable and an FAQ by the topic. So as we proceed, now the thing that's going to be tricky is that the approval date for each questions are not going to be the same. So obviously our FAQs are going to have the dates when it was approved by the board per question. And so it's a lot of background work that's been going on already with our IT staff. And so I'm hoping that we'll have something that's usable for our public by hopefully summer, fall time this year. Just a friendly reminder to our members what we're working on in the background. Okay, any thoughts, members? I know it's pretty short, so not too many, and I don't think that this is that much of a tricky discussion, so I think it's pretty straightforward. So looks good is all I need to hear. If it looks good, we can move on. I see the thumbs up. I see the head nodding.
Looks
So
good.
all right, we're
Looks
ready to
good.
move. Thank you, everybody. We're ready to move to public comment in Sacramento, please. Seeing none, we're ready to move to public comment in WebEx.
All right, this is the moderator for members of the public on WebEx. If you would like to make a public comment for agenda item 5, please click the raise hand icon, or if you're an audio only participant, you can raise your hand by pressing *3 on your device. And I do have a request from Miss Chasney Johnson. And Miss Johnson, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Hello, this is Pharmacy Technician 106559, Miss Chasney Johnson. This is a great idea. The pharmacy department does have a lot of paper usage and their day-to-day tasks being used to run an organization. Most items can be scanned and sent in a PDF file to any email to be saved on a hard disk. This task could eliminate filing of Pyxis refills, interdepartment billing sheets, return to stock, and schedule sheets. Some of these tasks can be tracked by username, so you could easily retrieve a printable end of task report by having the original document. You will be able to identify small gestures, for example, Pyxis interruptions by nurses, or why RTS prescriptions is out of its credit date range due to technicians writing do not credit. Digitizing pharmacy records could create more workspace, and thank you for letting me participate on this agenda item topic.
Thank you, Ms. Johnson.
All right, this is the moderator. It appears we have no further requests for public comment at this time.
Thank you, Sarah. All right, members. So we'll present these to the full board for approval, and I will work with staff to, again, integrate these FAQs with searchable that are by topic and also has dates of when it's approved per question, as we have now quite a bit of FAQs going on, as you can see from this committee, but also from the Enforcement and Compounding Committee, and then Communications Committee. So lots coming your way. So we'll try to make it all organized so that it is OCD friendly for a lot of pharmacists out there. Okay, members, we are ready to move to agenda item 6. We're moving very swiftly, which is great. But I do think that this, you know what, actually, I think we can power through this and maybe take a break. So I think this is not going to take too long, so we'll move through this. All right, agenda item 6, discussion of changes in pharmacy law included in Assembly Bill 1503, including updates on implementation activities. Transitioning to the next agenda item, which is an update on implementation activities related to AB 1503 that were previously identified and discussed. As a brief reminder, Governor Newsom signed the board's sunset measure, Assembly Bill 1503, on October 1st, 2025. With this action, significant changes to pharmacy law became effective January 1st, 2026. And it's April. Can't believe it. Time flies by. As I stated during our prior discussions, I'm so proud of the board's efforts to pursue so many important patient safety provisions. The board's legislative report and the final outcome on the measure reflect the board's strong commitment to California consumers and patients. During our January 2026 meeting, we received the first update on implementation activities undertaken since passage of the measure. Today, we'll receive additional updates. For some reason, the room went blank. I really hope that there's not a problem over there. Okay, there we are. All right, so today we will receive additional updates for many of the provisions. A list, as this is a continuation from our previous discussion, I do not plan to review each area separately. As we begin, I would like to remind members that the board released a newsletter specifically discussing the changes made in AB 1503 at the end of January, and more recently, the board released a webinar in its learning management system. It is my understanding 184 individuals already have completed this training since its release. I will quickly provide my comments on the various items and will then provide each of you with an opportunity to comment. First, beginning with the Pharmacy Technician Advisory Committee, as reflected in the meeting materials, Dr. Satinder Sandhu has been appointed to serve as a board member on the advisory committee. Thank you, Satinder, for volunteering for this additional commitment. I just really appreciate all the time In addition, the board member procedure manual has been updated to reflect the addition of the PTAG, PTAC, or whatever we're going to start calling it. I still don't know. It's still new, so it's still a baby. Doesn't have a name though. Baby doesn't have a name. We need to come up with a name. It is my understanding that online application portal will be available by mid-May. Do you have any comments or questions on the implementation activities related to the advisory committee? Okay, I don't see anybody jumping and unmuting. I'm going to quickly move on. So hopefully that's okay, members. All right, implementation activities related to retitling of advanced practice pharmacist to advanced pharmacist practitioner are underway. As noted in the meeting materials, the Section 100 regulation materials are currently under review by the Office of Administrative Law. The technical changes required in the board's IT systems have been completed. Any comments on this, members? Advanced pharmacist practitioner? We're good. Moving to provisions updating the definition of pharmacist. Following this statutory amendment, which clarifies that pharmacists are not restricted to practicing only within the four walls of a licensed pharmacy, you may recall that the board, power of a comma, you may recall that the board voted to initiate a rulemaking to establish parameters for remote processing of prescriptions. As a rulemaking process is underway, we will refrain from discussion to avoid any potential issues with the rulemaking process. As a reminder, consideration of revised self-assessment forms is being handled by the Enforcement and Compounding Committee. Tomorrow we have quite a bit, so I'm excited about the revised and streamlined approach the board is taking. The Enforcement and Compounding Committee will be discussing additional self-assessment forms tomorrow during its meeting. Separate from the development of the new self-assessment forms, the board identified a need to repeal the prior self-assessment regulation sections. As indicated in the meeting materials, the board began the process of repealing these sections through the streamlined Section 100 process. However, regrettably, the Office of Administrative Law, I'm going to just say OAL from here on now, determined the board must repeal these sections via the formal rulemaking process. Given this, it is anticipated that the full board will consider a proposed rulemaking during the meeting later this month. Members, any comments or questions on self-assessment process? I think some of you are on enforcement, so we'll see you tomorrow on that. Transitioning to implementation activities related to the standard of care practice model, as previously reported, the board's policy statement has been posted on the board's website, and conforming changes to the board member procedural manual have been made. Board trainings related to HIV PEP and PrEP, as well as naloxone, have been removed from the website as the trainings are no longer required by law. As indicated in the meeting materials, the board believed the repeal of numerous regulation sections that establish protocols and mandatory CE requirements could also be completed through the streamlined Section 100 process. Again, regrettably, the OAL determined the board must also repeal these sections via the formal rulemaking process. Again, it is anticipated that the board will consider a proposed rulemaking during the board meeting later this month. Members, any comments or questions related to the implementation activities for the standard of care provisions? Seeing none, ready to move on? We previously discussed the FAQs related to digitizing pharmacy records. Also, there are no additional updates related to ownership prohibitions, and we have already discussed a draft policy statement regarding non-resident pharmacies. Moving on to implementation activities related to changes in PIC provisions and staffing, as the materials reflect, the board's pharmacist in charge overview and responsibilities training webinar has been updated and is available in the board's learning management system. I really do recommend all pharmacists should listen to this. I still frequently get, I'm sorry, just a little off the cuff comments. A lot of my pharmacy students ask me, should they be PICs? And honestly, if they haven't graduated in the last year or so, I tell them you're a little too fresh because, you know, it's a lot of responsibility. So it is really helpful that they do take this training, and I highly recommend all pharmacists to be taking this training and listen on into this. Transitioning to the notice requirement for chain community pharmacies, you may recall the board approved a sample notice that could be used to meet the new requirement for a chain community pharmacy to post a notice that provides information on how to file a complaint with the board. The sample notice is now available on the board's website and was released via subscriber alert. As you can imagine, I had some pharmacies mistakenly think that this must be posted at all pharmacies. So just a reminder, this is for chain community pharmacies. I suppose nothing would prohibit you from posting these notices at any pharmacies and anywhere in California or anywhere for the matter, but this is legally required for a chain community pharmacies. Transitioning to the notice requirement for, okay, so members, any comments on this? Seeing none, and then that's it. There are no real updates on the remaining items. Any other comments or any thoughts related to AB 1503 members? I know it's slowly but surely settling down on a lot of changes that are happening. So, okay, well, we are then ready for public comment in Sacramento. Seeing none, we're ready for public comment in WebEx. Sarah.
All right, this is the moderator for members of the public on WebEx. If you would like to make a public comment for agenda item 6, please click the raise hand icon, or if you're an audio only participant, you can raise your hand by pressing *3 on your device. All right, and I do not see any requests for public comment at this time.
Thank you, Sarah. I really appreciate all the members. Your dedication and all the hard work is what gotten us to AB 1503, and it really is quite a bit of an accomplishment. So we all should be proud of the work, and I'm very proud of all the work our staff has put in. Really, our executive officer, deputy executive officer, Ann and Julie, and all the staff. Thank you all for all the hard work for implementation activities. Looking forward to hearing about it. All right, it's 10:03. Great time for a break. Let's go for at least 15 minutes. And so we'll come back 10:18. 10:18. Let's come back at 10:20. Why not? Let's take a little longer break since we're moving very fast. So we'll take a break. We'll come back at 10:20, members. See you all back at 10:20. Hi, members. Members of the public, thank you for your patience. I'm hoping that the technical difficulties is resolved in the room. So we're going to get started. Just to take a quick roll call, Satinder.
Present.
Thank you, Satinder. Renee.
Present.
Okay, and don't your video feed is not on though. I don't think. Oh, there you go.
Very slow. Thank you. I'm here.
Oh, and Jesse.
Here.
Thank you, Claudia.
Here, present.
Thank you, and I am here. All right, moving to agenda item 7, discussion of requirements related to the use of automated patient dispensing system, including provisions in Business and Professions Code sections 4427.3 and 4427.6, and California Code of Regulations, Title 16, Section 1713. Section 4017.3 of the Business and Professions Code defines an automated drug delivery system, or ADDS, as a mechanical system that performs operations or activities other than compounding or administration relative to the storage, dispensing, or distribution of drugs. Related to our discussion today, the section further defines an automated patient dispensing system, or APDS, as an ads for storage and dispensing of prescribed drugs directly to patients pursuant to prior authorization by a pharmacist. The meeting materials describe other laws and regulations relevant to our discussion today, including Business and Professions Code Section 4427.3, which states that an ad shall be placed and operated inside an enclosed building with a premises address at a location approved by the board. Section 4427.6 further provides that an APDS may be located and operated in a medical office or other location where patients are regularly seen for purposes of diagnosis and treatment, and that the APDS may only be used to dispense dangerous drugs and dangerous devices to patients of the practice. As indicated in the meeting materials, the board has received requests for clarification on the requirements for placement and use of an APDS. While I believe the legislative history and intent are clear, I place this matter on the agenda today to consider if members agree or to discuss if the board should perhaps consider developing regulations to more precisely define terms such as medical office or other location where patients are regularly seen for purposes of diagnosis and treatment, as well as to clarify which patients are eligible to receive their prescriptions from an APDS when receiving medical care via telehealth. As we're considering these specific issues, it may be appropriate to consider if current statutory and regulatory requirements remain appropriate. Members, as we open up for discussion, I look forward to your thoughts. And this is, I'm sure going to be an interesting discussion for us. So I want to start with anyone who has any thoughts on it, and then we'll open up and kind of go from there. Members, any thoughts? I know that also just want to highlight there were 3 written comments on this issues. So just want to make sure you've all received those written comments. Satinder, go ahead.
I just want to say that we should have a regulation that provides a maximum flexibility for the Californian consumers so they can, because the way the doctor's offices are operating and it is allowing flexibility to the patients to be seen in person or virtually. But I do want to make sure that our regulation reflects some protection so that there's not it accounts for a patient and practitioner or doctor, whoever sees them, a relationship. And I think reading the regulations, I feel like there might be some ways we can make it a regulation a little bit more clear to reflect the current practice. That's my comment.
Satinder, would you be inclined to probably do path of regulation development in your idea to clarify?
I think, yes, I would go that way so it's a little more clear. There's not it's not vague for the public out there or the folks that place these machines and with the intent so that it's clear, regulation is clear.
Okay. I think I could be supportive of that approach. Any members? Any other thoughts?
This is
Nobody
Renee.
seems. Oh, go ahead, Renee.
Hi. Yeah, I think, I mean, I feel like there's always room for clarity. But
Oh, Renee, you probably can't hear us, but I think. Oh,
think that, look,
sorry, Renee. Do you mind rewinding? You froze.
sorry. Yeah, I
That's
think
okay.
I think I'm not quite understanding, some of the, just because of my own experience, what for patient care, what's being inhibited. So I think hearing maybe from our comments, but still, even though these are prescriptions, it's like still the consumer protection needs to be maintained. So I think with that in mind.
Renee. And Satinder, your hand is still raised. Did you have anything else to add, or you just wanna?
No, I think I'm good. So sorry, I
Oh,
forgot to take it up.
no problem. That's okay. Anybody else before? I think it's good to probably open up for public comments to just kind of get the thoughts rolling. But Jesse, go ahead.
Yeah, I was going to echo exactly what Satinder and Renee had said. And I think I'll probably have more thoughts once I hear some more public comments.
Sounds good. And I think that, yeah, I'll probably also reserve after we hear from some comments. So we'll open up for public comment, and then we'll bring for members' thoughts after public comment. And just in case, I know some items are always more hot than others, so I just want to make sure that if we could just have all the folks that would like to comment to raise their hand as we do go to public comment. And so we'll start with public comment in Sacramento, and then we'll go to public comment in WebEx. So just to determine the number of individuals seeking to provide public comment on this agenda item, as we open for public comment, to determine if we need to adjust the public comment time, I'm hoping that all individuals interested in public comments to provide comments to either raise their hand in person or to raise your hand in WebEx. That's the least I can ask. So I see there's some folks in Sacramento, I think, is trying to provide public comment. So let's go to Sacramento first.
But okay, sure. Good day, and thank you for the opportunity to speak. My name is Tony E., and I'm a pharmacist representing Same Day Healthcare Pharmacy, which contracts with Dr. Stephen Guest here of the People Care Medical Group. Our mission is simple but urgent: to be able to expand pharmacy access for individuals who need it most. Those who lack transportation, those who live in chronically underserved areas, and those who have seen their local pharmacies disappear. As many of you know, pharmacy access in California and across the nation is at a critical crossroad. Declining reimbursement rates, amongst other factors in the pharmacy, have nearly reduced 30% of all pharmacies to close in the last 10 years. These closures have created pharmacy deserts, leaving communities without essential services and without the frontline healthcare professionals they rely on. In many neighborhoods, the pharmacy is the first point of care. When that access disappears, the consequences are profound. In response to these challenges, our company has developed an innovative, a viable, and sustainable drug delivery system, our APDS unit. This technology has the potential to transform how medications and clinical services reach the public. Our model integrates both telemedicine and telepharmacy into a single kiosk, bringing care directly into the communities for the people that live there. However, our recent APDS application was withdrawn. No true explanation was given, but it appears that it was due to the fact that telemedicine, as opposed to in-person medical consultation, was provided. No objection was expressed to the pharmaceutical portion of the application, which provided prescription medicines in a safe and secure environment in accordance with all regulations. The statute clearly allows for the APDS placement in locations where patients are regularly seen for purposes of diagnosis and treatment. And this is not limited to in-person consultation. Our model allows for the expansion of pharmaceutical services in a safe and secure environment. Today, we respectfully ask the board to clarify that an APDS unit can be placed at any location where patients are regularly seen, and this is not restricted to in-person healthcare settings. Making this clarification will allow technology-based solutions like ours help close the gap in pharmacy access and ensure that Californians receive the care they deserve. Thank you.
for the comments.
Hello, everyone. Hopefully you can hear me well.
So sorry. Oh, there we go. Oof, weird day of technical difficulties today. I don't think it's the weather, or is it the weather? I don't know what's going on up there in NorCal. So we lost them, everybody. So Sarah, you are at least on, right?
Yes, I'm still here.
Okay. I'm gonna
If you'd like, we could take the WebEx comments.
oh yeah, but I think the problem though is that those folks in the room may not hear the comment. So hang on, let
In the
me
meantime, I'm working with them on the back end.
okay.
Yes, President. Oh, they won't be able to hear, so I think we should hold them. This is Shelley, and I know I'm not acting counsel, but
Oh, thanks, Shelley. Hi, Shelley.
hi.
Okay. We'll just yep, they all lost the internet connection. So oh my God, it's just so strange day. Okay, well, I guess we are forced to then take a break. So I thought our meeting was gonna be quick and easy, but because of the technical difficulties, I think things are gonna get a little bit delayed. So I know these things take time to come back to it. So let's just do a 10-minute. I'm sorry, members. We'll do 10. We'll just do, actually, let's just try the 10:55 and so see where we are. So we'll come back at 10:55 just to give some time. It's like we're in a traffic in LA today. All right, see you back 10:55. Okay, weird day today. Weird day. And can you hear me?
Yes, we can. Thank you.
Okay. All right, members, just gotta take a quick roll call. It's not 10:55 quite yet, but I think we can get started. I see you, Satinder. Satinder?
I'm here. Here.
Thank you. Renee?
I'm here. Can you hear
Thanks,
me?
Renee.
Can you
Jesse?
see me?
Here.
Thank you. Claudia?
Present.
Thank you. I apologize to all the members and to the regular to the participants and to the public for this very unfortunate technical difficulties. Unfortunately, things happen. So thank you for your patience. And now we are ready to go back to you all on the room in Sacramento. Gentleman with a gray suit. I feel like that's gray. It's incorrect. I'm sorry. You may continue now, please. I hope that no more interruptions.
Thank you so much, and I apologize. As the licensing committee report indicates, the use of APDSs has been expanding and is currently regulated under the Business and Professional Code, including Section 4427-6. We're concerned, however, that the licensing committee report suggests an overly restricted interpretation of the current statutory status. Telemedicine is medical care. Care via telemedicine has been proven to equal to face-to-face care in a majority of settings. According to the Center for Disease Control, 80% of the primary care physicians are able to provide a similar quality of care using telemedicine as doing in-person visits. The Business and Professional Code 4427 provides that an APDS can be located in a medical office or other location where patients are regularly seen for the purposes of diagnosis and treatment. I suggest that a telemedicine kiosk fits that mode. In the Pharmacy Board Licensing Committee report, the report recommends that such location be restricted to only locations where patients receive in-person healthcare services as opposed to telemedicine. I disagree with that. The Pharmacy Board has suggested that the only location where valid patient evaluations and treatment can be performed is a medical office or clinic, and therefore they are restricting more modern and accessible alternatives to care. Their very narrow interpretation of the physician's ability to obtain an accurate history perform a focused physical exam, and arrive at an accurate diagnosis is incorrect. I suggest that this interpretation is incorrect as a matter of policy of expanding pharmaceutical access. First, the statute talks about other locations where patients are regularly seen for purposes of diagnosis and treatment. It does not say that it is to be restricted to only in-person medical practices. A medical consultation can occur just as effectively via telemedicine as it can in person. Indeed, if the board precludes telemedicine, it may discourage persons who would otherwise receive medical services, but who prefer not to be present in a physician's office. And that, we see that more commonly. Second, the statute says that other locations where patients are regularly seen, patients are now regularly seen via telemedicine, and as long as this is a private, secure location such as our kiosk, it's equal to an in-person consultation, in my opinion. In conclusion, the restrictive interpretation that the location where patients are regularly seen for purposes of diagnosis and treatment under Section 4427.6, Section J, is limited to an in-person consultation is not good policy. Our solution will allow greater and easier access to medical and pharmacy services. For example, Rancho Murrieta, who has reached out to us in distress, as there is no local pharmacy out there, and they are a remote senior community in Sacramento County, they have a strong desire for placement of multiple kiosks. This would provide pharmaceutical services closer and more convenient to the residents. The city of San Francisco has also indicated a strong interest to us in deploying kiosks in response to the closing of a majority of the pharmacies in the city. Thank you very much for your attention.
Thank you for the comments.
All right, are we ready to move on to comments from WebEx?
Is that all the folks in the room? Sure. Okay.
Yes.
We're ready to move. Thank you so much.
All right, for members of the public on WebEx, if you would like to make a public comment on this item, please click the raise hand icon, or if you're an audio only participant, you can raise your hand by pressing *3 on your device. All right, and we do have a handful of people, so I'm going to go in the order received. First, I have Sarah Moo, and Sarah, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Can you hear me?
Yes, we can hear you.
Okay, great. Hello again, Chairperson and members of the board. Sarah Polo Moo with the California Retailers Association and California Community Pharmacy Coalition. I'm providing verbal comments this morning as a follow-up to our written comments, and I want to thank Anne and her team for getting our letter up on the website very quickly ahead of this meeting. I want to also thank the board for their continued discussions on modernizing pharmacy practice. Technology paired with pharmacist oversight expands access, improves safety, and reflects how care is delivered today. I'd like to briefly address 2 areas where Clarity can further unlock the benefits of automated patient dispensing systems. Yes. First, telehealth is now a core part of routine care in California. When a patient is clinically managed by a provider at a clinic, virtually or in person, they are part of the practice's care continuum and are a patient of the practice. The statute asks where the APDS is located, not how the patient's visit occurred. Leaving ambiguity here risks creating an unintended gap where telehealth patients face barriers to medication access that their in-person counterparts do not. CRA and CCPC respectfully request the board to confirm that telehealth patients of a practice qualify to receive medications through that practice's APDS. And second, it has come to our attention that monthly in-person pharmacist inspections are being required for APDS units in medical offices. As currently written, neither the relevant statute nor regulation imposes this requirement for APDS in medical office settings. It appears only in provisions governing other healthcare settings such as health facilities and 340B covered entities. We request clarity confirming that pharmacists may leverage technology and pharmacy staff, like pharmacy technicians, to provide this support and oversight, consistent with how the board has already approached remote processing. There are no prohibitions on this approach, and it would align with the board's own standard of care, thinking around how pharmacies may deliver services. Imposing requirements beyond what the law prescribes adds operational friction without improving safety outcomes. Thanks again for the opportunity to comment.
For the comments.
All right, this is the moderator. Next, I have Emily Ha. And Emily, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Good afternoon, Chairperson, committee members, and staff. My name is Emily Howe, and I am a pharmacist here representing pharmacies who use technology to enhance patient access. I'd like to thank the board for its continued leadership in modernization, specifically on efforts such as remote processing and APDS. These initiatives show that when technology is paired with pharmacist oversight, we can significantly improve patient access and safety. The first topic to discuss is clarifying the board's concern regarding patients of the practice and allowable APDS locations. In light of the board's progressive stance on virtual care overall, I'm seeking a favorable interpretation of the code to permit patients to access APDS at their medical practices, regardless of how a visit was conducted. I'd like to share a specific scenario. Imagine a patient is at work and has a medical issue. They'll take a telehealth visit in between meetings with their PCP, and then on their lunch break or on their way home, they can swing by their PCP's office and pick up their medication from the APDS in the office, and then start treatment ASAP despite their busy lives. In order to enable this scenario, SB 1447 dictates 2 relevant requirements around the use of APDS. First, it dictates where an APDS can be located, and it specifically states that a medical office is acceptable. I want to be clear in stating that I do not advocate for APDS or kiosks to be in places like patients' homes or parking garages like stated in the materials. But the law does explicitly permit it to be at a medical office. It's important to note that this law also does not dictate where a patient receives their consult. It only dictates where the APDS can be located. Another important clarifying point is around patients of the practice. We respectfully ask the board to agree that if a patient is actively and clinically managed by a provider, regardless of a particular interface is in person or virtual, they are still a patient of the practice and eligible to use the APDS. This is in line with California's law on telehealth, and California has always been a leading state on this topic. I also agree that one of the board members had said that these prescriptions would still need to be within the valid patient-prescriber relationship as dictated by current California law. Again, we're not asking for kiosks to be outside or in patient homes. We are just asking for clarity today since these models are already in practice, and we don't want to delay patient care since we have laws that are very easy to understand. Lastly, I also mirror the comment around pharmacist oversight and not requiring the monthly inspections at medical offices.
Thank you for the comments.
All right, this is the moderator. Next, I have Hunter Young. And Hunter, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Good afternoon, President O and members of the licensing committee. Thank you for the opportunity to speak and for your dedication to serving and protecting patients across California. My name is Hunter Young, and I serve as the head of state government affairs for ATA Action. We are the affiliated policy and legislative advocacy arm of the American Telemedicine Association. I'm here today to speak because we have heard concerns from our membership regarding communications from board staff indicating that ADDSs would not be able to serve California patients who receive their prescriptions from California licensed providers via telehealth and virtual appointments without further discussion from the Board of Pharmacy. It is my hope that the discussion today will provide the necessary clarity for those folks. It's concerning to our organization as our review of California statute and board rules don't indicate any differentiation between patients who received a prescription from an in-person appointment and those who obtained one via a telehealth or virtual care appointment. Our organization firmly believes that patients should have the same options to see the prescriptions they receive from California physicians who they have a relationship with, irrespective of the modality of care through which that valid prescription was received. The California Board of Medicine makes no differentiation between telehealth and in-person appointments, and we do not believe that the Board of Pharmacy should either. Respectfully, we urge the board to make clear today that telehealth obtained prescriptions that follow all other standards of practice as mandated by California statute and other board regulation can be fulfilled via the automatic drug dispensing systems to ensure that all patients have access to the benefits that this technology provides, irrespective of if the valid prescription they received was obtained via telehealth or via an in-person appointment. Just to put a final point on it, we want patients to simply be able to pick up their telehealth prescriptions prescribed by their licensed provider at the automatic drug dispensing system if they are considered a patient of the practice. Thank you so much for the opportunity to comment, and our organization remains happy to serve as a resource for the board on any matters regarding telehealth or virtual care policy. Thank you again.
Thank you for the comments.
All right, this is the moderator. Next, I have Ms. Chasney Johnson. And Ms. Johnson, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Hello, this is Pharmacy Technician 106559, Ms. Chasney Johnson. Automated patient dispensing systems are mostly used in hospital settings. One of the upgrades I would like to see when using this technology is having automatic retractable drawers to close by themselves. It is easy and very common to visually find an employee of the organization using their feet or slamming the machine door. With a timed retractable door, as an employee, you will then be responsible to remove your medication or supply item, making sure to retrieve the first to expire. Once complete and all drawers and doors are closed properly, the employee is putting a timestamp that the machine was working properly at that time and the item removal was removed following guidelines. That is my feedback on this agenda item. Thank you for having this provided space to participate.
For the comments.
All right, this is the moderator. Next, I have Mike Clark. And Mike, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Good morning. My name is Mike Clark, Policy Director of the Convenient Care Association. On behalf of CCA, I'm here to request the board's guidance on 2 issues that directly affect whether patients in California can conveniently and affordably access their prescription medications. Since our founding in 2006, CCA's North Star has been ensuring that all people have access to accessible, affordable, and high quality healthcare, regardless of where they live, how they see their provider, or what barriers stand between them and the care they need. Our members, including retail health clinics, mobile health programs, and allied organizations, serve millions of patients each year in California. We have learned that the board staff communications have raised questions about whether automated patient dispensing systems, a type of automated drug delivery system, APDS, kiosks at medical office may serve patients whose prescriptions originate from telehealth visits. For patients, this distinction can mean the difference between picking up a medication conveniently at the clinic where their provider practices or facing additional trips, delays, and barriers that undermine adherence and outcomes. A patient who chooses a virtual visit with their provider is still a patient of that practice. They still need their medication promptly. They still deserve the same convenient access as a patient who walked through the door. What is the difference from a patient seeing a telehealth provider and sending a prescription to a retail pharmacy versus an APDS with pharmacist oversight? Why are we restricting access? A review of California's statute does not indicate any basis for treating these patients differently, and we believe that doing so would create an inequitable 2-tier system that harms the very patients APDS technology was designed to help. We respectfully urge the board to make clear that patients of the practice, whether seen in person or via telehealth, may access their prescriptions through APDS kiosks at a provider's medical office. Additionally, we ask the board to confirm that monthly physical pharmacist inspections are not required for APDS kiosks in medical offices. Board staff has indicated such inspections would be required. However, by statute, this requirement is not imposed for medical office kiosks. While other statutes do include monthly inspection requirements, those apply only to health facilities and 340B covered entities, respectively, not to the medical office settings. Imposing requirements beyond what the law requires risks reducing APDS availability, particularly in underserved communities where patients already face significant barriers to getting their medications on time. CCA shares the board's commitment to patient safety, and we believe clarity on both issues will serve patients by ensuring equitable, convenient access to their medications. We welcome the opportunity to discuss further and happy to provide any additional information that the board may find helpful. Thank you very much for this opportunity.
The comments.
All right, this is the moderator. Next, I have Stephen Gray. And Stephen, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Thank you for the opportunity again to comment. The first thing I'd like to point out, or just remind the board, and some of the board members are new, of course, that Board Regulation 1713 clearly designates a longstanding positions of the board regarding where a prescription that is filled can be delivered. And it does say that it can be delivered to a location where the patient will be receiving care. And that was very important to allow delivery to a physician's office, for an example, for homeless people that don't have a home or a business or a job, et cetera. The second thing I want to point out is this has been a long-standing confusion about the APDS and the board's authority over APDS. An APDS, as stated in the law, is just a type of machine called an ADDS. Again, it is a type of machine. Other entities, including physicians and clinics, and even some businesses and schools, operate an PDS that is not owned, operated, or serviced by a pharmacy. There is no law that I can find or ever existed that say that these machines can only be owned and operated by a pharmacy. They do have to be owned and operated by a pharmacy if the pharmacy services them, if it loads the drugs into with prescriptions it is filled. But if an APDS is owned and operated just as a machine, a type of delivery machine by an employer, by a hospital, by a business, even a medical office business, where the drugs may be delivered, or the drugs in the machine may actually be prescriptions that are dispensed by the physician. Physicians in California have the right to dispense medication to their own patients. They cannot own and operate a pharmacy. They cannot commingle drugs with other physicians and practitioners at that location. But it needs to be clarified, what the board's jurisdiction is over an APDS, and whether its own jurisdiction is only over those that are owned and operated by a pharmacy. That means the pharmacy loads, maintains, and inspects the APDS, or whether it has jurisdiction over an APDS that is owned by a practitioner or another entity. Right now, we have filled prescriptions being delivered to Amazon cabinets that are unique to the patient at schools, businesses, universities, etc.
10
I
seconds.
could make an argument that technically those are an APDS. Thank you.
The comments, Dr. Gray?
All right, this is the moderator. Appears there are no further requests for public comment at this time.
Thank you, Sarah. I'm sure this is going to be an ongoing discussion. So thank you, everyone, for your comments. Very thoughtful and respectful comments. So as I open up this discussion to our members, I'm just going to share some of my thoughts. So from what I see and hear and read, I think there are two different topics going on that we probably need to clarify and distinguish and discuss as we move forward, which is one is where can an APDS be located? And the other topic is which patients may be able to get prescription from these devices. So that's what I'm hearing. I hope I'm understanding these topics correctly. Unfortunately, from my perspective, bad news for our public commenters is I do not believe we can just provide a guidance from this meeting alone or from the board meeting alone. I think that statute, unfortunately, is not clear. And I think that the clarification can only happen via regulation, and those take a long time. And that's the bad news. And I'm going to rip the Band-Aid off to all of you. That's just the reality I think we're going to confront. you know, in the meantime, I understand, but I think there are many other avenues other than APDS, respectfully, that the patients may receive medications already. And so I think that that's just ripping the Band-Aid off. That's the truth. And I think that our legal counsel can correct me, or our executive staff officer can correct me, but I think that's where we are, unfortunately. We cannot just clarify an ambiguity in the statute via us talking at these meetings. It has to go through regulation. And I do lean on the side of our board staff's comments. And honestly, I do think that it is not as clear. And I do not believe we're exercising any of the inappropriate ways of interpreting statutes. I do feel that way very strongly. The one thing, though, that I do feel that we have some opportunities to clarify is about the monthly inspection. And we will definitely provide the update in the upcoming meetings when we discuss this topic at a full board. I will definitely work with our staff and our council to confirm and to clarify that. I would love for that to be clarified as well. The global point that I like to make as I open up for discussion to our members really is my deep belief that all of our healthcare challenges we face in America is not a one-size-fits-all solution. It will be the effort of all of this and many of the layers to provide and ensure an equitable access to health services. And there are tremendous value, I believe, of both virtual care and in-person care. I think we all would be foolish to think that virtual care can solve all the problems. There are quite a bit of opportunities a virtual care can provide. I truly appreciate the flexibilities, and I deeply appreciate, and I use it myself, the virtual care is great. But I do not think that that is, again, a fix for all. And I know that there are strong comments in supporting of those care, but there is a tremendous value of in-person healthcare as well. We're not going to be solving those issues. I just would like to provide that, I personally appreciate all of those comments, and there are opportunities and avenues. But again, I think there are so many opportunities and avenue for our pharmacy services, and I truly strongly believe in-person pharmacy services are an important and crucial component of pharmacy care delivery system. Then we must maintain this. We must promote and maintain it. So that's my belief. And I think this is where it's going to get tricky. And I know that these are, comments, and I appreciate these comments, but I know that there are many other ways, and I'm sure it can be solved in the meantime by mail services, courier services. So that's where we are. And with that, I'm going to open up for members' thoughts, and this will be an ongoing discussion. And I'm so sorry to all of you, but this is not going to be a quick and easy resolution to the questions that are brought upon us. So that's just going to be the case. So with that, members, any of your comments, I'm happy to hear. And one more thing also, thanks, Dr. Gray, for your comments. And that actually has been something that I wanted to discuss for a while, but I think maybe it's we'll discuss internally. I think that my understanding is slightly different than what maybe you're possibly making a position on, not as clear. So that would be one great discussion for us to have of the applicability of, in California, and, who is allowed to operate APDS. So alrighty, with that, members, any of the thoughts? And I see that Renee's camera's off, so I just want to make sure for the purposes of our compliance with the law that we are announcing if there's any technical challenges or connectivity issues, which is totally understandable.
I've been waiting for a chance to say something.
Thank you, Renee.
I've been frozen. It looks like I'm sleeping. I am not. I'm fully able to listen, and I am on camera in one, frozen position, but I've been on here. And I'll just take the opportunity to say thank you to all the public calls and the information, I do think it would be helpful to, I mean, I would agree, I'll just back up, agree with you, Song, about the kind of couple different discussions about where they can be located and who can get them. I mean, I absolutely agree. Telemedicine is definitely advantageous and here to stay, and you know, that all. But I'm just wondering, like, what are the locations of these? I don't feel like anything was discussed, and you know, these are drug storage locations. There's temperature control, or I mean, you know, I know the discussion, you know, if a pharmacist has to go there, or pharmacist or technician, that type of thing. But, you know, they do need to be, you know, clean and functional. You know, that just thinking of drug storage in and of itself. Because obviously sometimes people may not come and pick it up right away. And so is it there's that consideration. Then there's also security. Um, like, you know, again, where is it located? How secure is this thing? What's allowed to go in them? And, you know, again, but there's probably multiple tangents of discussions based on location. I mean, in, you know, in a medical office. But I don't know, I was just mentioned these kiosks, but it wasn't really defined, like, where is this convenient location? And that's a little concerning. And then, of course, there's, you know, just patient consultation with the pharmacist, and that ability. So you know, I'm assuming that that is available, but how readily available is it, or convenient for the patient, if they have to pick up their drug and later contact somebody or something like that. So, you know, some type of maybe even presentation about what are some of
Yeah,
these options.
absolutely. Technology.
Because
Yeah.
yeah, I mean, you know, there are pharmacies closing and there are pharmacy deserts, and we want to pursue all the possibilities. But again, with keeping some of the other things I mentioned in mind. So thank you, and I am here, and I just don't know when my computer will decide to unfreeze me.
No worries. It's a weird day of technological difficulties. But I do completely thank you for making the point about the technology piece, because I do think that even not all APDS is an APDS. That's the really important thing. APDS, not APDS is not APDS. There are APDS that is a locker, that is an APDS that is probably pre-filled, as alluded in the meeting materials. And I'm sure there are more advanced technologies out there that maybe we just don't know. And do we feel actually comfortable allowing those? And I think that there's a different layers of comfortability for what it is. To me, lockers, you know, I think is more of an easier acceptable solutions, because that's, you know, but am I comfortable letting an automated dispensing machine that just fills a prescription in a cell in the middle of, you know, wherever it may be? Absolutely not. I'm just going to be honest with you. No, I will not allow that in my my personal perspective. Absolutely not. That's just bifurcating pharmacist care. So no, I will, you know, I agree. It's really the layer of what it is. That's the discussion here. So that's probably the future discussion, not today. But great point. Any other members? And Renee has dropped off, unfortunately. I think she's officially lost the connection. Claudia, go ahead.
Okay, well, thank you so much for the public comments and the written comments. So what I gathered from the written comments was that there's some pushbacks against what appears to be an informal staff interpretation, so not formal rulemaking. And I think, Sung, this is what you're talking about. We don't have a formal rulemaking that says that, in fact, telehealth patients are able to use the APDS kiosk. Because at this time, it looks like they're being excluded in the narrative.
I don't think that's correct. Claudia, I would not characterize it that way. I can have Anne probably provide a more succinct explanation of what the situation is, because in general, pharmacy law is permissive. So you can only do something if it explicitly allows it to do so. And I think that the staff probably did not have a clear legal understanding. And I think Our council can support that. The statute's not written in a way. So that's where we are, and it's not that we could not just say, go ahead, just because that's not how things would work. But go ahead,
So
Claude.
we have to formally clarify that the telehealth patients have equal access?
Possibly, yes.
Got it,
Because the
okay.
statute's written where it does not. I can actually read a section of the statute. So an APDS may be located and operated in a medical office or other location where patients are regularly seen for purposes of diagnosis and treatment, and the APDS is only used to dispense dangerous drugs and dangerous device to patients of the practice.
So
So that's
So let's say I'm a patient and I call my physician and I say, you know, I'm gonna swing by and pick up my prescription, but I'm a patient of theirs, but the consultation was done via telehealth. I can't then have that service as a telehealth patient just for that consultation? That's why I'm a little confused as a public board member.
consultation. Are you referring to a consultation by a pharmacist or consultation by a prescriber?
By a prescriber.
Prescriber is totally separate. We're not talking about the telehealth. I think we're only talking about if a person was seen, right? And the seen is a big word. Now, a person was provided a care by a prescriber in telemedicine. Can that person be considered a part of the practice and who may or may not be able to obtain the medication at that robotic dispensing machine of the practice wherever they may be?
But what if they are part of the practice, that they're just using the telehealth feature?
That's where it's not clear. Yeah.
Got it. That's what I'm trying to get some clarity. And I think that's what the public's also trying to get some clarity. Thank you.
We cannot unfortunately provide the clarity of the statute that is unclear via the board discussion.
Understood.
It has to be a regulatory process. Yeah.
Okay, thank you.
Of course. Jesse?
Thank you. Echoing a lot of what Renee said, and I'll be the first to admit that I'm not familiar with this practice, so I think a presentation would be very helpful for me to understand the different types of APDSs, where they're currently located within the state. But kind of getting to Claudia's point, if you're going to a telehealth doctor, then the question becomes, where is the APDS that you're picking your medication from? Because it's unclear for me based off of the written comment and the discussion where we're trying to put these. That's outside. Of course, if you're at your doctor's office and you have an established relationship and there's an APDS there, that makes sense, but that's already covered, and that's the part that's clear. So I think moving forward in this discussion, I would like to see some clarity specifically on how we're operating within California right now. Maybe separate from that, the kind of patients we're serving, the kind of medication that's being dispensed in these APDSs, but then maybe separate from that, what it looks like in other states. I can vaguely remember maybe being in an airport somewhere where I saw an APDS in the airport, for example. I don't remember specifically what state or where, but I am thinking, if I'm understanding correctly, that that's kind of the direction that we're envisioning with this discussion, or at least from the perspective of the written comments, if I'm interpreting it correctly. So if we can get more clarification moving forward, I think it would be helpful. I will also stand firm and agree with President O that I really think we need to tread lightly with this and just ensure that we have the correct pharmacist oversight, and the ability for human interaction as we move forward.
Jesse? All right. I know this is going to be a lot of discussion coming up, so I appreciate everybody's thoughts. Anyone else before we move to the next agenda item? Okay. Sounds good. Thank you, Anne. I appreciate it. We'll continue to work with our staff to try to develop some regulation language in our coming future meetings based on what we have so far, and we will proceed. Again, all of your comments are really appreciated, and thank you all to our public and also our members for your thoughts. A lot more to come. Sorry that we can't just give clarity and answers on these things. And next agenda item is 8, discussion of proposal to establish definitions for outpatient pharmacies based on business model. As we have previously discussed, generally the requirements for pharmacies apply equally among a variety of business models unless otherwise specified. This approach allows for broad regulation, yet can become very challenging when business models vary, but requirements many times do not. Within existing law, there are several instances where a more specific definition is referenced, but only when applying to a specific provision of the law. The meeting materials provide an example. Pharmacy law does not currently include a general definition of chain community pharmacy. Rather, in specified sections of statute and regulation, the law refers to BPC Section 4001, which defines the composition of the board and sets forth the appointment process and qualification for board membership for the definition. Note, BPC Section 4001 provides, for the purposes of this subdivision, a chain community pharmacy means a chain of 75 or more stores in California under the same ownership. And an independent community pharmacy means a pharmacy owned by a person or entity who owns no more than 4 pharmacies in California. Today, we'll continue our discussion on this issue, and as a brief reminder, during the committee's October 2025 meeting, the committee considered this issue for the first time and reviewed various pharmacy business models. During the January meeting, we received presentation on 3 specific business models: home health services, skilled nursing facilities, and infusion center pharmacies. I believe these presentations highlighted the opportunity for more specific regulation if we pursue the suggested approach of developing definitions and tailoring requirements for specific business models. The draft definitions have evolved a little bit as our discussion has progressed. I personally review the current draft definitions and believe they are appropriate. And as I open up for member discussion, I would appreciate your comments on the various proposed definitions and would also appreciate your feedback if you believe additional pharmacy models would be included in our discussion. Also, as I open for discussion, I want to highlight to members the example of how the more precise regulation could apply, for example, to an infusion center pharmacy. This is discussed in the meeting materials on the top of page 16. This project or this discussion for a long-term, long plan purposes, this is going to be a long discussion for us, probably continue after my time and many of our members' time here. But we just want to start this discussion because I think that at this point, probably the best way is to do it via regulatory path and see how we can navigate this pathway from the regulatory path. I know sometimes regulatory path is very sluggish, but it seems like it's going to be a good starting point us to kind of get things rolling in that way. Also, another reminder that, you know, this is not to add more burdens, but really to streamline and some regulation and to really remove some barriers for care for some of the businesses, as I know pharmacy law can be very challenging. And so this is really while maintaining our mandate of consumer protection. So that's what the intent of this. I know it feels like we're discussing the same thing over and over again, but just because we're trying to fine tune it as much as we can. And also last reminder, this is for PHY license type. So that's why, you know, we're really looking into these definitions for within PHY model. So that's why we are here in these definitions. So with that, any thoughts, members? I think that next meeting finally will have a regulatory language if you all feel like this is the right direction. So that's the plan. Anybody?
I'm okay with that plan. I think there's a lot of room for discussion, but I think just getting the process started, I'm excited that we're getting it going.
Thank you, Claudia. The thought that I had one more thing about the chain community pharmacy is, you know, in our statute same ownership. So I'm curious if that actually means exactly same. See, this is where the lawyers come in. I tell you, the things that it sounds like, oh, it's fine, it's simple. But then I'm like, you read it again, and then what if it's actually like same name, but it's owned by like it's like a franchise. What if it's a franchise? Does it apply? I don't think they apply because it's not a same ownership, right? So anyway, go ahead, Satinder, and then I'll go to you, Jesse.
I agree that I think further discussion and would be very helpful because as is now, just the chain pharmacy definitions, there's kind of conflicting reports. There's leaves a gap of, the way it's described in two different places. The also, I think that in terms of enforcement or regulate, like there's some practices where the requirement under PHY, you're checking for things that are really not relevant to that practice. So it's a burden and serves no consumer protection, is waste of time for everybody. So I think having these definitions and clarifications, it could streamline some of the regulations that we have in terms of enforcement.
Thank you, Satinder. Jesse?
Hi, thank you. Truthfully, I worry with how quickly pharmacy is evolving that we're almost setting ourselves up for failure by defining these things. Kind of echoing what Satinder said, there are some gaps, even just kind of looking at these definitions. For example, if you have a pharmacy that owns more than 5 pharmacies, but less than 75, what kind of pharmacy is that? It's like in between an independent and a chain. It's not really covered by these definitions. I also would be curious to hear if these are the only services or groups served by closed door pharmacies. I know we have like a specific list, but I feel like there could be more in there, or it could evolve over time. Another thing too is where there may be overlap. For example, online pharmacies. An online pharmacy could be a mail order, or it could be a closed door pharmacy. It could be a specialty pharmacy. As presented, I mean, we definitely need more discussion, but I'm worried that it's not possible to really define every setting, especially as it evolves. I understand the need for clarification from a legal perspective. I'm just not sure how we go about it.
Thank you, Jesse. Your comment is exactly why I've been very hesitant to bring this up for a long time. And so, but I think there was a need, and there is a need, and I do think that there is a benefit overall for us to really try to be a little bit more precise and to remove unnecessary requirements, and to do so in a more holistic and clearer way is via the this definition path, because I think that it would be a little bit hard for us to define a practice within each sections of the regulation, then exempt them out, and each time a regulation for each section is developed. So that's why this approach is contemplated. And so I will work to develop a regulation language with our staff, and it's probably going to be a little bit of a slog. So we'll see where we land, but I do hear you completely. That's why this is something I didn't really, I just kind of been hard for me to wrap my head around, to be honest with you. And it still is, because of exactly your concerns and comments. It's just everything moves so fast, right? I mean, it's possible in 10 years we have, there's no these could all be non-applicable. I mean, so or we all just sit at home and AI does everything. Hey, you know what? It's okay. I'm fine with that. Just kidding. Not really. Not at all. Not at all. Just kidding. So anyway, it's a lot more to come, and we'll definitely keep all of us posted on the progress. Any other members' thoughts before we move to public comment? Okay, we're ready for public comment. Where are we in Sacramento? I think the room is empty. Yep. Okay, room is empty, I think. So we'll go to public comment at WebEx.
All right, this is the moderator for members of the public on WebEx. If you would like to make a public comment on this agenda item, please click the raise hand icon, or if you're an audio only participant, you can raise your hand by pressing *3 on your device. All right, and we do have a couple requests. First, I have Sean Kim, and Sean, you'll be given 3 minutes to speak with a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Good morning, Chair and the board members. This is Sean Kim from California Pharmacists Association. We appreciate the board's efforts to consider definitions of outpatient pharmacies based on the business model. As pharmacy practice continues to evolve, and many other committee members has mentioned, we encourage the board to keep any definitions as broad and flexible as possible. Pharmacist's role, as well as the pharmacist's expectations, responsibilities are expanding rapidly and across whichever settings that we're talking about. Right now, we're talking about outpatient setting, but it applies to every other settings too. And the prescriptive regulatory language can quickly becomes not applicable or may unintentionally limit innovations and patient access. So similar to standard of care framework conversation that we have had over time, a more flexible approach allows practice to adopt while maintaining accountability to patient safety and quality of care. We appreciate the board's consideration and looking forward to continued collaboration. Thank you so much for letting me comment.
Thanks for the comments, Dr. Kim.
Apologies, this is a moderator. My my WebEx decided to blip. I'm assuming the public comment is complete.
Yes, it is,
Okay,
Sarah. Thank
thank
you. I'm
you.
sorry, I did not realize that. Man, it's a weird day of technology. I think we all just
Yeah.
need to. You're done with the meeting already? Almost there, guys.
All right. We'll move on to our next person requesting public comment. I have John Gray, and John, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Hi, good morning. This is John Gray, registered pharmacist with Kaiser Permanente. Thanks for the opportunity to comment. At times over the last several years, the board has found it necessary to apply different standards or requirements to chain community pharmacies. For example, the enhanced fining authority in Business and Professions Code section 4317.5. Many times when the board has discussed pharmacy practice at chain community pharmacies, the discussion has focused on the wide range of services that pharmacists within a chain community pharmacy are expected to perform, providing vaccinations, travel medicine services, and furnishing PEP and PrEP, for example, while also still preparing and dispensing medications. The board has often discussed how the current state of pharmacy practice in chain community pharmacies might impact the pharmacists who practice in those pharmacies. I encourage the board to consider the differences in practice at certain managed care outpatient pharmacies, such as Kaiser Permanente's. Our pharmacies are located in our medical office buildings and hospitals, where patients are able to receive clinical services from their providers. As a result, pharmacists in our outpatient pharmacies tend not to face the same time pressures associated with administering vaccines or furnishing medications, such as PEP and PrEP, pursuant to a protocol, while also managing, your conventional pharmacy medication preparation and dispensing. So I encourage the board to consider whether certain outpatient managed care pharmacies look like the pharmacies that the board has sought to regulate in a differential manner by using the term chain community pharmacies. And if they do not, is another definition, something like managed care outpatient pharmacy, needed. And thank you very much for the opportunity to comment.
Thanks for the comments, Dr. Gray.
All right, this is the moderator. Next, I have Ms. Chasney Johnson. And Ms. Johnson, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Hello, this is Pharmacy Technician 106559, Ms. Chasney Johnson. Since we are on the topic of defining things for outpatient pharmacy on business models, is there any way hospital information technology departments can create or add a function to the emergency room and hospital system-wide patient tracking list on how many discharge prescriptions was printed or created and how many of those discharge prescriptions have been sent, received, and being worked on by the hospital outpatient pharmacy? If the nurse assigned to the patient had a feature that indicated if pharmacy services was talked about in the discharge process, hospital readmission should reduce, ensuring medication adherence and preventing adverse events. It bridges the care gap by verifying that patients receive, understand, and safely begin their new medication regimens, reducing admission risk. With live features like pharmacy prescription display board, any department personnel scheduled can contribute to enhancing patient satisfaction, which streamlines the transition from hospital to home by addressing logistical barriers and providing on-the-spot counseling. Thank you for having this topic to discuss. Prescription tracking board would be a term I would like to be considered.
Thanks for the comments.
All right, this is the moderator. Next, I have Stephen Gray. And Stephen, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Thank you very much for the opportunity. I also appreciate the complexity and the confusion that this has caused over the years and may, as Jessica, start us down a path that makes it even worse. I would point out you might want to talk to some other boards of pharmacy. Other boards of pharmacy have gone down this path. I know, for example, Texas at one time, maybe not now, had A through K outpatient pharmacy designations with different technician ratios in each one and all kinds of things going on. So, you know, others have gone down this path. You may want to consult them. Second, I'm concerned about your proposed definition of a non-dispensing pharmacy. The word pharmacy by definition implies that it has to be licensed. The current definition of a pharmacy is a place where or area where where the profession of pharmacist is practiced and where prescriptions are compounded. So the definition you propose could encompass having to license AmCare locations, call centers where there are no prescriptions that are compounded, there are no prescriptions that are dispensed, there are no prescription drugs that are maintained. So you might want to watch that one real carefully. In the closed door pharmacy, that first came up as a problem with hospital pharmacies. You do not have hospital pharmacies listed. They are in hospitals, they are often closed doors. The public is not allowed in them. In fact, there's no sign on the wall that says it's even a pharmacy for security reasons. Inspectors came out and demanded that they put signs and licenses on the outside of the wall of the pharmacy because that's what the law said, was that the licenses and certain things had to be posted. In other words, there was a particular problem that inspectors created because they could not, under inspection policies and practices, differentiate. And I think that you might be better off going down and talking to all of your inspectors about what things should apply to different pharmacies and what should not. I would say that the posting of licenses, the poster and everything outside the pharmacy should not apply to closed door pharmacies because by definition, there is no intent to serve the public by posting a sign in a closed door pharmacy. Thank you very much and good luck.
Thank you, Dr. Gray.
All right, this is the moderator. Appears there are no further requests for public comment at this time.
Thank you so much. I really appreciate these comments because it's always helpful, always good to hear from perspectives. Just a few thoughts from what we heard. I do ask, you know, I know these comments are really appreciated, but if you have ideas of how to make this better, please email us because it's very helpful. So I urge Dr. Kim, Dr. Gray, both Dr. Grays, just email us your ideas and we'll see if we can incorporate those into these proposals. Also, what Dr. Gray, Steve Gray, has alluded to is why we're trying to kind of resolve these issues and why we're trying to discuss this. And so thank you for the comments. Members, hearing some of these comments, any additional thoughts before we move to the next agenda item? We're very close here. Go ahead, Satinder, and then Claudia.
After listening to the public comment, which is very valuable, and I totally echo your comments about the having an input from various stakeholders to make sure that we don't create something that's unintended. And as Jesse pointed out, it's going to be very difficult, and we definitely don't want to be creating definitions that will not allow, flexible enough to have new innovations come through. And we're in same situation as that earlier topic that we talked about, trying to create another regulations because we can't clarify it or change it at the moment. So just my thoughts.
Right. Yeah, and I completely hear you, Satinder, but I just want to highlight I think we're trying to let people be exempted out of certain requirements if you fall into these, so that it's to be the benefit of all of them to self-identify. And if you self-identification as determined by the PIC, as it'll be written in the regulation, I'm sure, if your definition does not meet it, then you just default is to follow the regulations, right? So I think it's hopefully not to be the adversarial, but to be really just to be more flexible. And so but I do hear it. I don't know why. It's the same topic. I think it's just this, our nature is to, like, I think it's just kind of it's good to be questioning of the intent of this and to really make sure that it's for the right purposes. Claudia?
I agree there.
Thanks again for all those comments, and I do echo your sentiment. Anybody who's willing to send us an email, please do so with your thoughts and ideas so we can have a further discussion on this. So thank you.
Thank you all. All right, hopefully we'll have some regulatory language, but as I said, to please, if you have any ideas to share with us, because we would like to proceed on this gently. As all of you know, we've been proceeding very gently. And so please share your thoughts. Appreciate your comments. Okay, everybody, we're ready to move on to the next agenda item 9, discussion of licensing statistics. The meeting materials include a summary of the licensing statistics for the first 8 months of the fiscal year. Given the timing of this meeting and release of the meeting materials, data for March was not available. I've asked staff to include the licensing data for March as part of the board meeting materials for the later this month. Processing times for the various facility business types vary and continue to fluctuate. While a few of the licensing programs are within the board's performance targets, others exceed the 30-day target. As a quick reminder, the processing time noted in the meeting materials represent the oldest application of each type. The average processing time is lower. Thank you to all our licensing staff to working so diligently to process application. Our licensing manager, Debbie, works tirelessly with our deputy executive officer and executive officer to always make sure all our applications are processed as fast and as efficiently as we can. In the first 8 months of the fiscal year, the board has issued 6,452 individual licenses and 501 permanent site licenses, with an additional 761 temporary site licenses. I believe these numbers alone demonstrate how busy the board's licensing staff remain. Also want to note that there is a significant increase in the number of pharmacy technician applications the board has received. I'm really looking forward to seeing the annual statistics at the end of the fiscal year and to see if this growth continues. And I hope that's actually real number. I'm sure it is, but I'm curious what's going on down there. So love to know. Members, any thoughts on this before we move to public comment? Seeing none, oh, Jesse, go ahead.
Oh, thank you for bringing up the technicians. I was going to ask that too. I'm curious to see if we have any insight on that, and maybe we can report back at some point later this year.
Yeah, absolutely. That just jumped out. So I was curious what happened there. Good thing though. Good problem, I think. So, all right. Any other members? Seeing none, we're ready for public comment. The room is empty, so we're gonna go to public comment in WebEx.
Right, this is the moderator for members of the public on WebEx. If you would like to make a public comment on this item, please click the raise hand icon. Or if you're an audio only participant, you can raise your hand by pressing *3 on your device. And I do have a request from Stephen Gray. Stephen, you'll be given 3 minutes to speak in a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Thank you very much for the opportunity. It's interesting to me, a comment that there's an increased number in the PHY pharmacies. Now, that may or may not indicate a increased number in the general category of chain or the general category of dispensing pharmacies, but you may want to have more discussion about that from a statistical point of view as you decide what to do about pharmacy deserts, et cetera. The other thing I would suggest you take a look at, both for its value and both for the problems it's created. Some boards of pharmacy across the country have a new category of specialty pharmacy, where they only treat certain diseases. Now, California has a lot of those. For an example, one organization that I'm very familiar with has a lot of oncology pharmacies that are licensed as PHY, and they only dispense compound oncology drugs. So if a patient walks in there and say, I want my birth control pills, it ain't going to happen. So you want to be careful about how if you define specialty pharmacy, and you can have problems going down. Now, California already has some, I think, recognized specialty pharmacy, such as pharmacies that handle radioisotopes, nuclear pharmacies, as they're often called. And so I would just suggest that, again, connected to the last subject, we want to be very careful about whether we need to keep statistics about something versus rather have a licensed category of something. Thank you.
Thanks, Dr. Gray.
All right, this is the moderator. It appears there are no further requests for public comment at this time.
Thank you, Sarah. Just to share with our members in California, I hope I get this right. Kick me under the table, but you cannot, and I'm sorry. In California, if there's more than 50% transfer of ownership on any reasons, then it's a new licensure. So then it's why the application for the site, there is an application, but the number of PHYs in totality may not go up. It's just an ownership transfer. Also, the change of location also is treated as a new application, and so that's just one of those things. Okay, any other comments, members? All right, guys, we made it. Even with we would have been done a bit of about 30 minutes earlier, but it's still 12 o'clock, so we made it. Next agenda items 10 and 11, advisement of future committee meeting days and adjournment. Before we adjourn today, I would like to thank all of your members of the public and all of you all. Thank you for being here. I always appreciate everybody's such a dedication, your time, and commitment to California consumers and patients. So thank you all. We'll see you all at this committee in June, but we will see you all in 2 weeks in Sacramento. So hopefully in person. We'll see you all, and take care and have a great rest of your day. Bye.